If you're dealing with sciatica type pain, this sucks. Like, this thing is the worst. And the pain will really vary from person to person. It can be like just like a dull ache to sharp pains to burning or tingling, or maybe just like a total weakness down the back of your legs. And I've had people tell me like, yeah, if I stand like this and then I close this eye, then it doesn't hurt. But anything else I do, that hurts. But this, yeah, I'm good. Hey, what's up? What's going on? So it can really be confusing for people to figure out what's going on and how do I make this better? And what makes it a lot worse is that the actual underlying cause that's creating it is really going to vary from person to person. Like if they called this like needle in a haystack syndrome, it would make sense because it can be really difficult for a person to figure out what's going on and how to correct the issue. So in this video, I'm going to help you understand the different possible underlying causes that can create this. I also want to help you understand that when they tell you, oh yeah, this is what's causing it for you, it's just a genetic thing, sorry about your luck, I want to help you understand there's actually steps you can take to improve those scenarios. I'm also going to share some steps you can take to try and get some immediate relief while you're working on the underlying cause of this issue. Let's jump in.
TC Hale is not a doctor and does not claim to be a doctor or licensed in any type of medical field. Don't be an idiot and use anything heard on the show as medical advice. This information should be used for educational purposes only, and you should contact your doctor for any medical advice. Now get off me.
So remember, I'm not a doctor, I'm not giving anybody medical advice, but I will share some studies in the description below this video that we'll reference when we're going over these things so that you can dig into those a little bit more if you want to and help you find the right questions to ask your doctor. But when we're looking at this sciatica issue, we have to understand that there's this sciatic nerve that runs from the bottom of our spine down to our feet. And basically what goes on is here in this lower part of the spine, we have these discs. And a lot of people are going to say that the most common cause is a herniated disc or some type of bulging disc in the bottom of the spine. And then when that happens, these discs here that allow our spine to be flexible, so I can do this. Hey, look, I can do this. That's because of these things that are movable here. But they can kind of get bulged out or herniated. And then they'll kind of poke these nerves that are going through here, and if it pokes that nerves or puts pressure on it or squeezes it or pinches it, then it can send pain or numbness or whatever that discomfort is for you all the way down the back of your leg. So you're like, oh man, the back of my leg is broken. But it's just that this nerve is having this signal go through like, hey, something's horribly wrong and I'm going to let you know about it. And I've heard from other experts that say it's just not always this herniated disc issue. A lot of people have herniated discs and they have no symptoms at all. So we want to look at the other possibilities that can come up and then understand why would I have a herniated disc in the first place. Usually they're just going to tell you, hey, you're old and that's all used up. So that's how it goes. But the reality is that some of these structures can get a little more weak or a little more used up a little quicker for some people. And there's reasons this happens, and I want to help you understand these reasons in this video. But this is a really common issue here. It's just some type of herniated or bulging disc that is causing something to pinch that nerve, whether it's the disc that's pinching it, or maybe it's just causing this whole structure to sit differently, and when it's sitting the wrong way, now something is pinching that nerve. So you're also going to hear a lot about degenerative disc disease, where just these are becoming more weak or thin or easier to break or bulge out. You may also hear about stenosis issues, where it's just like a narrowing of that channel that those nerves flow through, and when you narrow them, now something's going to allow that to be pinched and create a lot of problem. Also can be issues with muscle tightness, and this might have to do with this piriformis pain. And this is basically a muscle down here in your buttocks that kind of runs across there. And if that becomes too tight for one reason or another, then it can push on this nerve and create this sciatica type issue. You'll also hear about bone spurs and calcifications. So you can see there's a lot of different ways that something can get in the way of any of these structures. If you have a bone spur or some type of calcification here on this bone, then that has the ability to present this nerve with, hey, now there's something new pushing against you that wasn't there before. Why don't we make you scream a whole bunch? So there's a lot of ways that this nerve can be pinched or restricted or just smashed and create all of this discomfort. Another possibility that is a little more rare is you can hear about sciatic herpes zoster. And herpes zoster is just like the virus that causes chickenpox, and then when we're older it can cause shingles, and this virus can lie dormant, and then when it becomes active again, it has the ability to create some nerve issues that can feel like sciatica pain. So this is common as well. And then you're also going to hear a lot about other health issues that can go along with this. And when something is as confusing as sciatica, it's nice to look at other things that are common to show up with it so you can get an idea of what may be creating that trouble for you. So we hear about osteoarthritis, where again all of these connective tissues are just becoming degenerative and broken down, and then things aren't going to connect the way they're supposed to, and then it has the ability to pinch against those nerves. You hear a lot about type 2 diabetes and obesity having the ability to all this extra tissue is pushing against things and not allowing them to flow correctly. With diabetes, they'll tell you that, well, this high sugar level has the ability to create nerve damage. We're going to talk about some other things that can go along with that as well. And then you also hear about fibromyalgia, and a lot of people that are dealing with fibromyalgia will also deal with this. So when we're trying to understand why these things are often seen together, I'm going to put a link to a paper down below that helps us understand that when the body is not getting all of the nutrients that it needs to get, because maybe a person is eating from a vending machine, or they're not eating food that really has quality nutrients in it, or they might not have the ability to break their food down to access the nutrients that are in the food that they're eating, then the body still needs these nutrients to function correctly. And it's going to say, well, I'm going to get them anyways. And the body has the ability to break down its own tissues or even its own connective tissues, like we're seeing here. And so if a body is really depleted of nutrients that it needs, it'll just kind of break itself down to get those nutrients so that it can continue functioning for the rest of that day at least, right? So when we're looking at this, we have to understand that this degenerative disc disease and herniated bulging discs that happen more than once, and it just seems easier for this person to have a herniated disc, because a person can have a real injury, some type of car accident or some type of sports injury, where they can really create like a herniated disc or a bulging disc type of situation. But people can also have problems when, like, hey, remember that time I looked over there real quick and I've been all jacked up ever since. So I just don't look over there anymore. I only look at things that are on this side. And so it doesn't have to be a major event to create this type of problem. And this is because these structures are not being rebuilt and repaired the way that they're supposed to. Every day, during the day, the body should move into what's called a catabolic state, where it kind of breaks down tissues so that they can be rebuilt and renewed. That's how the body renews itself. So when people tell us, you're just old, you're all used up, a lot of times it's because the body's not rebuilding itself the way that it's supposed to. At night, it's supposed to move into an anabolic state where it rebuilds and repairs. So the problem is that some people can get stuck where they're just kind of stuck in the daytime state all the time, and they're not moving into that rebuilding state at night. We call this a catabolic imbalance. The person is just kind of stuck in the breakdown state most of the time. But another problem is when we're going into that rebuilding state, we need to have resources to rebuild with. The body needs amino acids and collagen cofactors and all these things that it uses to rebuild and strengthen all of these structures. So if a person doesn't have enough nutrients coming in and the body is just breaking itself down, then all of these things are going to be much easier to damage or to wear out a lot faster. They're not being rebuilt, they're basically just in this degenerative state. So if someone is having these type of issues that are creating it, it's usually going to be that they're stuck in that catabolic imbalance type state that we were talking about, or they have what we call an electrolyte deficiency, where you can just kind of tell that the body doesn't have enough resources to function correctly. It's usually because there's digestive malfunctions going on that are really common. So if you have any type of digestive symptoms at all, like burping or bloating or acid reflux or constipation or diarrhea or nausea, or even like acne or skin type issues, or maybe just indigestion, like food just kind of sits there like a rock in your stomach for 6 hours. Any of those are signs that digestion's not working correctly, which means that you're not getting all the nutrients out of your food, and there's going to be a deficiency of resources that the body has available to rebuild and to strengthen all of these structures. So those are pretty common issues to see when these are the problems. Other things we want to think about are this stenosis type issues or muscle tightening. When we're looking at these type of situations, we want to think about why would a muscle be more tight? And in a lot of cases, it's because there's not enough calcium at the tissue level. And that doesn't mean that a person needs to supplement with calcium. It means that the calcium is being displaced in most cases. So the most common thing that's going to do that is blood sugar going too high. Calcium likes to follow sugar, just like you would follow an ice cream truck when you were 8 years old. Calcium follows sugar. So when blood sugar is high, like we see in type 2 diabetes, calcium is going to leave the tissues where it's supposed to be and go to where that sugar is, in the bloodstream. So the problem is when too much calcium leaves the tissues, then those tissues can't relax correctly and they'll be a little bit too tightened or tense, and then we can have these issues where we're having this piriformis type pain, where this tight muscle here is causing this to be pinched off. Now the problem is that a tight buttocks muscle can cause this problem, but all those tight muscles in there can also just be a symptom of these nerves being pinched off. So it can be a little bit confusing as to, do I have this issue or not? So we like to look at, are there other signs that maybe you're pulling too much calcium out of the tissues? Like, is your blood sugar high? Or are you eating too many carbohydrates or sugars? Or maybe a person is taking too much vitamin D, supplementing with too much vitamin D or getting too much sunshine can also pull calcium out of the tissues, because that vitamin D is pulling the calcium into the bloodstream and making it kind of calcium retentive. So vitamin D is great. We need vitamin D. I'm not saying don't take vitamin D, but a lot of people are told to take way too much these days, or maybe they're getting way too much sunshine, or they're eating way too many carbohydrates and sugars, which is very common. Any of those things can pull too much calcium out of the tissues and make these muscles tight or tensed up. Another thing that can happen is that there can be muscles in the back or the buttocks there in that lower back area, and if one area is tighter than the other, now things are not going to sit right. Things are going to be a little bit jacked up, and that has the ability to pinch these nerves and create a lot of this discomfort as well. So sometimes it's just about helping the muscles and all those tissues relax the way that they're supposed to. We'll talk about some steps we can take to do that in a second. But in one of the links below, it talks about how this is common to see with insulin resistance and obesity, and they kind of view it like, well, with the obesity, it's all this extra tissue that's pushing on things and maybe pinching the nerves. And I kind of view it like, well, if a person is obese, there is usually insulin resistance involved. There's a lot of factors that can lead to obesity, but when the obesity is there, a lot of times it's a high carbohydrate, high sugar diet that is at least contributing to that. So that's going to be part of the situation. Too much sugar pulling calcium out of the tissues again. With fibromyalgia, we recently did a video on a deep dive into fibromyalgia improvement, and we talked a lot in that video about different things that have the ability to pull too much calcium out of the tissues and create some of the problems that are creating that fibromyalgia. So it makes sense that people see this together with this sciatica issue. And we'll put the link to that video in the description below if you're dealing with that as well, and that'll get you a lot more insights that'll help you understand steps that could help you improve the whole situation. And when we're looking at these osteoarthritis situations, again, we see this a lot of times in the body is almost just like breaking itself down because it doesn't have the resources it needs, or it's stuck in this catabolic breakdown state and can't move into the rebuild and repair state like it's supposed to. So when we're looking at trying to create improvement for this situation, the first thing that we want to look at are some stretches that are very popular. And when I was training clients in the gym in LA for a long time, I would see a lot of clients that were dealing with sciatica, and we would use a lot of stretches. And stretches have the ability to open up those tissues a little bit and allow some minerals to get back into the right place to allow them to relax in some scenarios. But if a person does stretches that allows some of these things to relax more and then goes and has a piece of pie that's going to pull all the calcium out of the tissues again, they're not really creating any improvement. But I view these stretch type situations as a very important step. I think that if somebody's not doing stretches, they're not really trying to improve this. I view this as the most likely way to create a fast improvement for a person that gets them through a day a little bit better. Now, there are a lot of specific stretches that I use with my clients that seem to work very well. I'm not going to show those here, that's just not my jam, but I did find a video of an occupational therapist showing how to do these stretches that can be really helpful, and he even talks about different stretches for different types of issues, whether a person's having these types of piriformis muscle tightnesses or degenerative disc issues. He shows you some different routines that can help you out. So I'm going to put a link in the description below to that video so you can check that out and know that that's really going to help most people. At least see some improvement, but I don't view that as the solution. I still view a person needing to fix the actual underlying cause of what's creating these issues, or they're just going to keep coming back like is so common for so many people. So the stretches are very big. Now, if somebody has high blood sugar or some type of insulin resistance, you really got to get that under control. Why would this improve if you didn't? Because you're just going to continue to pull all the calcium out of the tissues. It's going to continue to cause some of these troubles, and it's just going to come back. So taking steps to bring down your fasting blood sugar, if it's over 100, that's a sign that you're leaning on that insulin resistance side. So you can pick up a glucometer at a pharmacy for 40 bucks and just check your fasting blood sugar first thing in the morning and see, is it over 100? If it is, then this is something that you need to work on. And we have a lot of videos about improving insulin resistance. I'll put the links below. We're not going to get into that here, but that's going to be a very important step for a lot of people. Any digestive symptoms, that has to be improved right away. We talk about that in almost all of our videos. We'll put a link in the description below for our video on full digestive reset, and that goes really into depth and how to repair digestive malfunctions so that you can break your food down and get the nutrients out of that food so that your body has the tools it needs to rebuild and strengthen these structures. Now, one thing you can do right away is you can drink bone broth, or you could supplement with some collagen supplements. Both of those can kind of give your body an easy access to some of these amino acids and amino acid cofactors that your body uses to rebuild these structures. Your body can't just take protein and redo this. It has to break it down into like these amino acids and all these nutrients that it uses to rebuild those. So those are some easy ways to give your body some nutrients while you're working on improving the digestive malfunctions so you can get those nutrients from your food. But that means we may also need to know, are there imbalances going on, like maybe this catabolic imbalance that's restricting a person from moving into that rebuild and repair? We gave it the tools, but maybe it can't go into that rebuilding state. So our totally free digestion course walks you through simple self-tests that you can do at home with tools you pick up like at a pharmacy or a health food store to get an idea. Am I leaning too far on this catabolic side? Does my body not have the ability to move into this anabolic state? Now, these aren't diagnostic things, but they can give you an idea of, oh wow, it really seems like I have a major issue there, and putting steps to improving that could allow my body to regenerate itself the way that it's supposed to. So we'll put a link to that totally free course in the description below if you're new to this channel, and that'll walk you through figuring that out. And the course also shows you how to improve that imbalance if that's a problem that you're dealing with. And one thing that can be really helpful is an amino acid called lysine. And lysine has the ability to help you push calcium back down to the tissue levels. So if you're having this issue where it's this muscle tightness that's creating it, that can be a big thing. And when we're looking at these bone spurs and calcifications, these usually happen because somebody's pulling too much calcium out of the tissues, and then the calcium gets dropped and then it gets deposited in the wrong place. And we create like bone spurs or calcifications in places where it shouldn't be. So that can happen when somebody's eating too many carbs and sugars, or if the body is mining its own tissues for the nutrients that are not coming in. The body can mine these tissues to try to get like things like phosphorus or something, and it pulls these nutrients out of the tissues and calcium comes with it, and the body uses up these nutrients and then drops the calcium, and then the calcium becomes this deposit that creates some type of bone spur or some other type of calcification. So you can see there's a lot of trouble that has to do with calcium, and none of it is really the calcium's fault. It's because we're eating in a way that we really should not be eating. That's the most common cause. Or these things in our life today have created digestive malfunctions that are restricting our ability to access the nutrients. But in either case, when we can fix those things, now we're not going to continue to create these problems like the bone spurs or the calcifications. So lysine is very helpful at pushing that calcium back down to the tissues where it's supposed to be, so it's not floating around and getting deposited in the wrong place and creating all this trouble. Now you've reduced the ability to create these bone spurs, but you've also reduced this muscle tightness that was coming from not enough calcium in that tissue level. And one more really interesting thing is that when a client has some type of herpes breakout type of situation, whether it's this type of shingles type breakout or maybe just a normal herpes breakout, we use lysine because pushing calcium back down to the tissue level allows the immune system to be triggered that there's a problem. A lot of times these breakouts come because too much calcium has been pulled out of the tissues. Now the immune system doesn't even know there's a problem and the virus kind of takes over and they have some type of breakout. So it's interesting that lysine has the ability to help quite a few of these underlying causes in the right scenario. So the bad news is that this is complicated. It's not super easy. I can't just tell you what to do, right? That's super annoying. Why didn't the punk tell me what to do? Well, it's going to be different from person to person. But the good news is that it's not a life sentence just because you have something that, oh, well, your parents had that, so it makes sense that you have that, stupid parents. There's things that you can do to improve these scenarios. If your blood sugar is too high, you can change the amount of carbohydrates that you're bringing in and create improvement over time. If there's an obesity issue or muscles are too tight, there's steps you can take to improve those scenarios. These stretches can really help most people create at least some improvement while they're working on these things, but you want to do the right stretches for these issues that you're dealing with. So take the time to learn how to do the right stuff. But there's some of these steps here that can start moving you in the right direction while you're working on actually fixing the underlying cause. So I hope that gives you some insights on how to look at your body chemistry a little bit and figure out what's going to be the most important thing for me to work on. A lot of people are going to have more than one of these things going on at a time. It's very common to see someone who doesn't have the nutrients the body needs and for the body to be stuck in this state where it's breaking down most of the time. So just look to see what's appropriate for you and start putting effort in that area. So we'll have the link to that free digestion course in the description below so you can learn how to look at these things to see if they're a problem for you or not. And right now, if you are having any type of digestive symptoms, jump over and check out that video on full digestive reset so you can start creating some improvement there and help the body work the way that it's supposed to. I can't wait to hear about your results.